What are some top products that maybe people should consider installing or having on hand if they do have a loved one that's a fall risk?
Well, not only is it, is there a plethora of these devices, but it's not a one-size-fits-all, kind of a thing. So I always recommend the inclusion of a physical therapist in particular to identify the specific need of what type of equipment could be provided. So a cane, for instance, or a quad cane, or a rolling walker, the ones with the tennis balls and the two wheels on them. Or the four-wheel walker with the hand brakes and different things like that come into play. Again, each of these devices is appropriate for a certain level of function, and it's important to obviously bring somebody with a certain level of skill set to introduce the appropriate device. It comes into play. But if we have somebody, for instance, who is having difficulty maintaining balance, as they bathe or anything like that, we all know that a tub shower or anything like that can be very, very slippery. So perhaps a shower chair so that they can sit, while they're bathing, is something that we could introduce that could decrease the risk of falls or certain things like that. So I always like to include, a multitude of skill sets when it's appropriate when it comes to durable medical equipment, assisted devices for ambulation, and going from there. So very, very important, because the introduction of those devices has proven time and time again, statistically, overwhelmingly, in the body of literature that's out there, that a simple introduction of that type of technology is substantial in decreasing the risk of a fall.